welcome back to the Blossoming Journal. For those of you who are returning, thank you. And for those of you who are joining us for the first time, this is the Blossoming Journal. It's mainly a platform to spread mental health awareness, but I also do talk about topics concerning pop culture or trends that are happening all around the world, which affects our mental health in general. And today I wanted to talk about a specific medication that I was recently put on. And the thing is, where do I start? Like, really, in order for me to lose a large amount of weight rapidly too, the same way I rapidly put it on, I needed to rapidly get it off. My doctors decided to put me on a diabetic medication, which is meant to treat diabetic type 2 patients. It's also meant to help with cardiovascular health, but here is the plus side. It also causes weight loss. So I think you can already imagine that this is a miracle drug. I get to just take it and lose weight. No, it's not that easy. I've actually made a video about this earlier on. I didn't want to say the name of the medication because I didn't want a lawsuit to come over it, but I feel like this time I really have to say what medication it is, what is it for, and most importantly, the side effects. And while every single person is different, granted, I get that, not everyone is gonna experience the same kind of side effects for the same period of time or the severity of it, but still, any kind of medication you take has side effects. Obviously, your doctors would have prescribed it to you knowing well enough that the outcome or of you taking this medication would, overcome the side effects, therefore making it safe. But let's be honest, doctors don't always tell us the exact things that we should be hearing from them. And so that's why I want to talk about it. And I'm going to talk about it based on a mental health perspective, because any medication that you take in order to lose weight, they all somehow seem to have one thing in common, and that is it makes you depressed. And then I'm going to explain to you why it is so important to learn the side effects of what it is you're taking, because sometimes, it could be life-threatening for some. At one point, it was for me. SAXENDA apparently is the one that gives you the fastest results compared to the other types of medications. And that was why I was put on that immediately. But even though it's the fastest way to shed all the weight, it also has the most side effects. The side effects of SAXENDA are extremely dangerous. And when I say extremely dangerous, I mean for those of us who suffer from depression or anxiety or bipolar or any of these other mental disorders. I have major depressive disorder, and I was not told that SAXENDA, one of its major side effects, it causes depression and suicidal ideation. As your body is trying to get used to this new drug that's coming into your system, your adjustment period. Now, unfortunately, in my case, by the second week, I was incredibly depressed. I was already starting to have severe suicidal ideation. I had only lost 2 kilograms at that point. Fine, 2 weeks, 2 kilograms. Pretty good, isn't it? But is it worth it? I believe that I'd rather be overweight, maybe not obese, but overweight or chubby, than suicidal every single day. At the end of the day, it just comes down to what you can tolerate, what you can take, what your body is telling you. My body was telling me to stop. And eventually, when I stopped Saxenda, I was put on Trulicity, which is dulaglutide. It pretty much across the board, they all have very similar side effects. The only difference is Trulicity takes a much longer time for you to see the effects of your weight loss.
OZEMPIC, it is literally the hottest drug in the country right now.
OZEMPIC, semaglutide, the one drug that everybody is talking about on the internet, on social media. Celebrities, influencers are all promoting it and saying that it's magic, basically. And I have to agree.
Social media users.
It's here.
The FDA has reported intermittent shortages of the drug. Social media users like TikToker Alyssa Clayton praising the drug's results for slimming down. Alyssa sharing these before and after photos of the effects of the medication over the course of 18 months.
And there's a literal shortage of Ozempic in many countries. And you know why? Because the effects of weight loss is guaranteed. The average weight loss that you would experience with Ozempic, and we're talking about a time frame of between 1 and 6 months, is anywhere between 10 and 20% of your weight. It's the same as Saxenda and Trulicity. It lowers your blood sugar levels, as I mentioned. It slows the digestion process in your stomach, and that makes you feel fuller longer. It also controls the hormone in your brain that tells you that you're hungry or that gives you cravings. So you kind of have less appetite and you're also craving less things, but you're also eating a lot less. It's basically understood that you need to take these medications together with a low-calorie diet and exercise. So it's not just inject yourself once a week and just sit there and wait to shed off. You actually have a lot of work to do still, because you need to make sure that you stick to a low-calorie diet. And when I mean low-calorie diet, I mean anything between 1,500 calories and below. I was targeting about 1,000 calories and below, because less than that would just be insane for me, at least. And I was managing that. Here's the thing though. If you're gonna lose so much weight so rapidly, and therefore it sounds magical, then you gotta ask yourself, okay, why? This is guaranteed and it's so easy, so what's the trick here? And it's a good thing if you ask that question, because the trick is the side effects are also really horrible. And yes, I have to sing praises to it because it is true. In this whole journey where I have included Saxenda, Trulicity, and Ozempic, I've managed to lose 22 kilos. Very proud, very happy, but it was not easy. I'm gonna tell you what happened to me, because as I said earlier before, everyone experiences things differently. In my case, because of my depression, it actually made it worse. So the same way Saxenda made me extremely depressed, so did Ozempic. It does interfere with your mood. Okay, next. Remember how it's a diabetic drug. If you are not a diabetic person, you don't need to control or lower your blood sugar levels. It's important to have a diet. It's important to eat. And it's also very important to stay properly hydrated and to have all the nutrients that your body needs to function on a daily basis. I was not able to eat anything at all because I was incredibly nauseous. And the thing is, it's not that I didn't want to eat, I couldn't eat. There's one thing to want to be on a diet and then you're restricting your calorie intake or your portions, or you're doing your intermittent fasting, but it's a completely different thing when you can't even swallow food. So I was basically just surviving on liquids. And eventually I thought to myself, if this is going to be the way it is, then I might as well put myself on a low calorie kind of shake. I use Optifast, and it's from Nestle, and it is brilliant. It's got all the vitamins and nutrients that your body needs, fiber, everything. Whatever you are lacking because you can't eat it, you can't consume it thanks to your nausea, I was able to sort of like compensate with this shake. So it's meant to be a meal replacement. And in my case, it was meant to sustain me and keep me alive. Because I mean, how can you go on without eating, right? Even though I was taking the shakes, it was not enough. I was not able to function or go out or do anything because the dizziness was so bad. I couldn't even stand. I had many episodes of getting up and falling right back down. I've hit my head a couple of times. I suffered a concussion as well. I was in the emergency room for an entire night under observation. So when I get up, I have, from either laying down or sitting down, I have to get up very slowly and slowly like compose myself. But the thing is, when that's happening, you literally feel like you're going to collapse, and that is what happened to me. I fell unconscious so many times. That is freaking scary. It's like, what the fuck, man? I'm taking this to lose weight, and I'm gonna end up with a brain hemorrhage at the end of the day, or because I've had too many concussions from falling down. It made my anxiety really, really bad. And so I'd wake up every single morning with almost like this hole in my chest because of my anxiety. And anyone who suffers from generalized anxiety disorder or any of the other types of anxieties, you would understand that pain in the chest. It's almost like a feeling of dread. It's a dreadful feeling, honestly, and it's painful, it hurts, and that is anxiety. So I was waking up every morning with that. I was back to square one. I was losing all the weight, which was amazing. I mean, every morning you go weigh yourself and you're like, oh my god, you literally seeing, the kilograms going down. But at the same time, you can't function. You can't get out of bed. You can't do anything because you're either so dizzy or so nauseous, or you're so lethargic and so tired, and you can't eat. You become very malnourished. You will develop dizziness and nausea on top of the side effects that are already there. So it's like a double whammy in a way. I did not have suicidal ideations, thank God, but came to a point where I had to really sit down and think about it and weigh out my priorities. Do I continue taking OZEMPIC because it's a guarantee that I will lose more weight? Because ideally I need to lose another 5 kilos. I know I'm shooting for the moon here, but that's my ideal weight, 5 more kilos. So I sat down and I was like, do I want to really go after that extra 5 kilos, or do I stop now? Because I think I've had too many concussions to continue on with this medication. So I decided to give it a break. And I've been off it for a week so far, and the nausea and the dizziness is still there. Of course, not so prominent anymore. It doesn't affect me as much as it did when I was taking the injections. Thankfully, my appetite has not increased. It's somehow maintained in a way. Thank God my weight hasn't gone flying high up again. So far, it's maintained. But then again, remember, this is just 1 week that I've been off it. Maybe if I were to see you or talk to you in 2 months' time, then maybe I would have put on all the 22 kilos back on. But there is one very important note to make though. The moment you stop taking Saxenda or Trulicity, and more prominently Ozempic, you will gain back all that weight that you lost. And so that is why it is advised that you need to complement this treatment with a diet, low-calorie diet, and exercise. But if you can't even stand because you're so nauseous and dizzy, how are you going to exercise? I couldn't even do yoga, like the most simplest yoga for the sake of stretching and meditating. I couldn't even do that. So I was like, what's the point then? So I decided that I've already lost a tremendous amount of weight. If I'm going to go for the extra 5 kilos, I'm going to have to do it the traditional way, which is my diet together with exercise, or just be patient with the process of losing weight slower, because when you're on Ozempic, you lose weight like that. But if you're going to do it the traditional way, then it's going to take you a little bit longer. So to me, my priority is not having any more concussions and falling down or losing balance or just blacking out. Reason why I want to talk about this is because of people who do have issues with their mental health. You have to weigh out the pros and cons. And if you must be put on a medication like Ozempic, for example, if you have issues with mood disorders, then you have to be very, very careful. And slowly I am starting to see a wave of people coming forth telling their horror stories, basically, because there's so many people who have had terrible experiences with Ozempic.
Talk about the truth when it comes to Ozempic.
On muscle loss, number 2, accelerated aging, number 3, kidney disease, number 4, blurred vision, and number 5, thyroid cancer.
The way these drugs work is they mimic a hormone in the gut called GLP-1, and that stimulates the body to produce insulin. It can also curb hunger, and it slows the stomach from emptying. And it's that last thing that doctors are focused on now. Our reporter, Brenda Goodman, talked with 3 patients who had sort of a severe effect of that actually caused, or their doctors think perhaps caused, stomach paralysis or gastroparesis, a severe form of that, and that can cause severe vomiting and nausea.
It is really alarming. And the worst part is that there's not enough research.
Calling for more research into the side effects of very popular diabetes and weight loss drugs like Ozempic and Wegovy.
Because now everyone is going out to get this medication, this magic medication to lose weight. And so those who are actually suffering from diabetes or have cardiovascular health issues do not have access to that drug. Now, I don't know, I mean, you tell me, like, what is this world coming to?
With people claiming that they've lost huge amounts of weight, talking about their successes, and as a result of all this publicity, there was literally a run to doctors to prescribe this medication for them off-label in order to help them with their weight loss, which unfortunately ended up creating a shortage, which puts people at risk who desperately need the medication because they have a true diagnosis of diabetes.
If you were put on a diabetic medication with the aim of losing weight because you are obese or you're overweight, or you need to prepare for bariatric surgery or a mini bypass sleeve, then yeah, I understand that you might need to take that drug. But unfortunately, in the cases of, I would say, maybe half or more than that of the people who consume these diabetic medications for the purpose of weight loss, they are basically taking away the supply of medication for those who truly need it. And that is so sad. I was put on these diabetic medications, Saxenda, Trulicity, and Ozempic, for medical reasons. I'll see you guys very soon with another video. Take care. Bye.